If you don't know this, you need to go back to school, okay? Everybody, I'm your fave nurse B. So in this video I did a poll on my channel, and I asked you all, like, what did you want to see next? What must you master before graduating from nursing school? Okay, now I for one believe that you really ain't gonna know nothing until you start working in the field. I mean, you're not gonna know it because you're not doing it. You have one patient while you're in nursing school. Like, you don't know nothing, y'all. Like, you don't know nothing, girl, until you start working. But there's some things that, like, okay, if you don't know this, you need to go back to school, okay? Before we get into the video, make sure that you like and you comment and you subscribe. What I want you to do is tell me in the comment section, like, are you nervous about graduating from nursing school? Do you feel like you're ready to start working with patients? And once we go through these skills, I want you to, like, put down below, like, what skill do you want to work on more? And what skill do you feel like, okay, I got that, girl. I got that. I mastered that skill. Let me know in the comment section. Also, go find me and everybody else. Like, the party don't stop here. It goes on and on at the YourFavNurseB Facebook group. But I'm so grateful for everybody on there. Like, it's so super helpful. And, like, I kind of go into more of, like, my personal life a little bit more on there than I do here on this platform. So go check it out, you all. And everybody on there is so helpful. Also follow me on Instagram at YourFavNurseB #1. All right, let's get into the video. So tip number 1, if you don't know this, like, your girl, boy, come on, you must know how to do vital signs. Like, you have to know. Now, I'm not talking about no machine. Only machine you should be using is a pulse ox, because I can't look at somebody and know what oxygen level they're at. Like, I just can't do that. But a pulse ox is the only machine that you should be using. But you should not use any type of devices. It needs to be manual. Well, of course, with temperature too. Okay, so those two things. But you know, you need to know how to do a manual blood pressure. You need to know also what are the normals and the abnormals for adults, geriatric patients, and also children. And that right there helps you for not for clinicals, for NCLEX. Like, already, once you know the normal vital signs, that already puts you, like, it helps you out. Plus, you need to know if your patient is going through a crisis or something is going on with your patient. Like, you need to know vital signs. It's vital, okay? Know that the fifth temp, pulse, heart rate. Yeah, the 5th vital sign is pain. Am I getting this right? Shoot, do I know my vital sign? 5th vital sign is pain. So remember that, okay? You must. It's just like a thing. You know, you go into a room, you talk to your patient, are you having any pain, any discomfort? You must ask that question with your patients every single time, okay? Remember that. The second thing is that you really want to be strong in your assessment. With nurses, we are as strong as we are at assessing, only as strong as our ability to assess a patient, I believe, because we treat signs and symptoms. We're not here diagnosing folks. We're not here, like, initiating things. You know what I'm saying? Like, so we need to be able to see when something is happening with our patients so we can communicate that to the doctor, and the doctor can tell us what to do. I'm not saying, like, nurses are hopeless and, like, we don't have any nursing interventions and we're just, like, calling a doctor for everything. But the biggest part of your job is watching these people and making sure that they are okay. And if they're not okay, doing something about it. Okay, so something that I really was like, why didn't I learn this? Like, why was I slacking on it? Lung sounds. Oh my gosh, y'all, know your lung sounds. There's plenty of stuff on here on YouTube. You can just look up, like, normal lung sounds, crackles, bronchi, wheezing, all that. You can just hear it, you know, and then just listen to people's lungs. When you go to clinicals, even if it's not your patient, I just need to listen to your lungs. I just want to see how you're doing. Boom, put it on their back, put it on their front, and just see. Have them take deep breaths, deep breaths, and just assess the heck out of your patients when it comes to lung sound. I wish that I did this, like, more and more. Also, you can assess heart sounds, which we didn't really do that in nursing school as LPNs. I think it's more so RN, but I don't know. Y'all let me know. But you need to also do bowel sounds. So you know that you have to check, like, each quadrant. I believe it's like 2 minutes before you can say there's no sound at all. You know what I'm saying? Like, understand how to do bowel sounds for your patients. palpating, asking them about their bowels, things like that. You have to be inquisitive, okay? Do this starting at clinicals. You must ask questions. Don't be embarrassed. You are going to be somebody's nurse, so you have to keep prying and getting information from people, because they're not just going to lend it to you. A lot of patients, some patients will tell you their entire life story. Some will, but some you have to kind of pry, and they're like, oh yeah, I did forget about that. Yeah, yesterday I didn't have bowel movement, and I really haven't had one since Thursday, and today is Tuesday. So yeah, I'm gonna need for you to ask your patients questions, get information. You have to assess, collect data. It's all part of the nursing process. If y'all want me to do a video about nursing process, I will. I don't even know if people still do it. Like, I think they was like kind of phasing out when I was in nursing school. AdPi, do they do that still? I don't know. Y'all need to get with it. Y'all let me know. Are they still doing the nursing process in nursing schools? Do you all still learn that? Along with assessing your patient, their bowel sounds and their lung sounds, and in some instances heart sounds, you must understand what's abnormal, and you need to understand how to document this information, okay? You can't just say that resident has diminished lung sounds and right lower lobe, period, end of it. Put your name, your signature. What did you do about it? What did you do? What else is going on with the patient? Do they have shortness of breath upon exertion or at rest? Are they drinking fluids? Does the patient have any pain? Do they have any type of temperature? Well, what is their temperature, I should say? Have they started any new medications? Did you give them any type of PRN medications? Did you contact the doctor? You know, you can't just leave it like that and be like, oh, okay, I assessed them, that's it. You didn't do nothing, okay? So you need to understand how to properly document assessments that you find that are abnormal, okay? And you have to do something about it. Now, of course, as a student, you're not thinking about what should I do about it, but you gotta start getting that going in your head, like, okay, if this happened to my patient, what would I do? And I wish more nursing schools would kind of have those scenarios. Towards the end of our nursing program, they started to try to do that, but for the most part, it's like, look at the book, read it, and be done with it. Like, you need to actually start learning now how to apply what you're doing, what you're learning to an actual person. If you listen to somebody's lungs and they abnormal, or you're gonna just leave it like that, or you're gonna try to do something, or you're gonna ask your patients more questions, or you're gonna get more assessment. This is why I say everything goes back to how you assess your patient, okay? So that's my next tip. I don't know if that's second, third, I don't know. Now, going back to asking questions, like I said, you have to just be inquisitive and get as much information from your patient as possible. Why? Because when you call that doctor, they don't know anything that's going on. Some of these doctors have literally 1,000+ patients. It's crazy, I know. They're not gonna know about little Jimmy. Like, they not gonna know about him, okay? So I need for you to give that doctor as much information as you can. Paint that picture. And I have a video talking about how to talk to MDs and like how to actually call a doctor and not be nervous, be confident, and be like, okay, doctor, let me get my orders. And they're like, okay, girl, here you go. I have a video talking about that, so go check it out. I have videos for everything. Just go watch everything, like everything, comment, do everything, okay? Help your fave nurse be out, okay? Anyways, I digress. But you gotta paint that picture. That's why I say assessment is key. Ask questions, ask the family questions, ask other nurses questions, ask CNAs questions. You have to learn how to be nosy, really, and paint a picture and really try to understand what is happening to my patient, and start that in nursing school. I think so much as students, you just are there, you're passive. Nobody wants to tell you anything. Nobody cares about telling students anything. They're like, students, oh no, I ain't got time for that today. Like, you're like, okay. You know, when it comes to clinicals, like, okay, I just sit back and do nothing all day. No, you need to be as assertive as possible. Of course, be respectful, but ask questions. Because really, y'all, once you graduate, I'm gonna just be honest, once you graduate, nobody cares that you just got into nursing school. Like, they don't care. You know, you graduated, you're a nurse now, you got your license. Like, it's all on you. So you need to start working on it now, and you need to start getting your nurse swag together right now. But do know, of course, everything comes with time. Like I said, you're not gonna know nothing coming out of nursing school. Don't think you know anything at all, okay? But you gotta learn it, and it's gonna take time, and you'll get it. But just understand that Like, nobody is going to be protecting you anymore. All right, your teacher was there to protect you, the school was there to protect you, but once you get out there, you by yourself. And I'm not saying that to like scare anybody away from it, because like I said, over time, with you actually putting in the effort, you will be like a great nurse. I mean, you will be the next YourFavNurseB. But no, really, like, you all will do well, but you got to come out with that mindset, like, okay, like, I got to do this because I have a license. I worked hard for this license. Like, I need to protect it. I need to do my best for my patients, you know? And I think in school, like, they don't really talk about that. They just be like, oh yeah, you know, the doctor or this. Like, it's not real. It don't get real until you're out there and you make a mistake. And you like, oh, this is all my fault. Like, what do I do now? That goes into my next tip, is know when to ask for help. Now, some people, while they're in nursing school, they're not humble. They just like, I got this, all A's across the board, boom, boom, wham, wham, thank you, ma'am, give me my license, like, I'm good. Girl. Anyways, you need to learn how to ask for help. But of course, prior to asking for help from your professors, from anybody, think it through in your own mind. Try to process what you would do by yourself as a nurse. What steps would you take, you know? And then when you get to that point where you're like, okay, I don't know nothing, then you need to ask for help, of course, you know? But you need to know when to ask for help. You may not know what to do, but when you know something is wrong, then you know what to do. Meaning, I think I talked about this in another video. I had a trach patient. I was a very new nurse. My first day working on the floor. The other nurse was off the floor doing something else. First day orientation, I'm in there with the CNA, moving this lady, doing all this in the third, and we both looking at her, and her breathing is like, and he's like, I don't think that's right. I was like, I'm looking like, I don't think that's right either. I didn't know what to do, but I knew that something was wrong. And at that point, I knew what to do. Go ask for help, girl. Like, I don't know what to do. And then I talked to the nurse, and I felt bad. Like, man, like, I didn't know what to do. Da 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 da. Like, I'm not a real nurse. She was like, look, at least you knew something was wrong and you knew to ask for help. That's all it comes down to. And that's true. You know, don't beat yourself up about it. If you come out of nursing school and it's stuff that you don't know, like, don't beat yourself up about it. But you can't just let shit pass. Like, you cannot. Don't let stuff pass because you don't know what to do. Okay? You need to ask for help. Like, don't be that nurse that just let stuff just keep going to the wayside because you either afraid to ask for help, you don't want to ask for help, or you feel like, well, I don't know what to do. Like, I don't get it. Like, if something wrong, well, maybe the other nurse should have did something about it. No, it's on you now. It's your patient, okay? I need for you to take care of this. I don't know if y'all heard my baby. I got to get upstairs to my baby. But the last things, honorable mentions that I would say is, of course, you need to learn how to do Foley insertions for men and women. Of course, let's see, G-tube feedings, flushes, and also assessment and documentation of those. With all of these, you need to understand documentation. Understand documentation. If you don't document it, girl, you didn't do it. I got a video talking about documentation. I actually like that video I did, but go watch that. And then you need to know about blood sugar checks, of course, how to document abnormalities, since you did for that. And then also IV administration, and know the math. Because sometimes I have gotten drugs where I had to actually write the math, like write it out to know how many milliliters per hour I had to administer. Like, so know your math when it comes to IVs. But also, you must understand documentation. If you don't come out of nursing school with anything, come out of it with a sense of, let me cover my ass. And I got a video talking about, I think it's called Cover Your Ass, like learn how to document, I don't know. But you need to understand that, because I'm telling you, they don't care. And I wouldn't care either. I don't care if you're a new nurse. Like, why is this happening? Why didn't you do anything? You're still a nurse, right? Like, I wouldn't care as a patient, you know? So, understand proper documentation. Do some research. Look at my videos. If you have questions about documentations, let me know. If you have questions about any of this, let me know. I'm your fave nurse B. I hope this video was helpful. Once again, I don't do anything that I do. I don't do anything to fear, like, put fear in people, make you feel like, oh, I'm not gonna be able to succeed. It's gonna take time. You might come out of it like, okay, I got this, and you might do well. But most people, it just takes time to really understand how to be a nurse, get that nurse swag, and like just boss it up and get it done. It takes time, but you must remain humble, and you must always be inquisitive, and you must always ask questions. That's inquisitive, right? And you must always go back to assessment. Always go back to assessment. If you feel like, oh, what do I do? Go back to assessment. Ask more questions. Get more data. Go from there, okay? And ask for help. All right. Peace.